Good afternoon. My name is Regina LaBelle. I'm the director of the Addiction and Public Policy Master's Program at Georgetown University's Graduate School of Arts and Sciences. Thanks so much for joining us today. And I'm joined here today by Adam Myers, Dr. Adam Myers, who is Emeritus Faculty at Georgetown University and the Associate Dean of Graduate Education. I'm also joined by Heather Connor, who's with the graduate school, who will answer questions about graduate admissions and other programmatic questions. And then, of course, Ryan Hampton. Ryan is an author, advocate, and friend who is going to lead us, start today by with just a little bit more information about why this type of program is so important for people in the addiction policy field. So Shaima, can you just show one, the first slide, and then I'll take it through and turn it over to Ryan. So next slide, please. So what we'll do today, again, we're going to talk about the information session objectives are to introduce you to the program, talk about the course offerings, describe admission process and financial aid, and discuss some careers and addiction policy. And then at the end, we're going to answer some of your questions. So Shaima, I think you can stop the slide share. And with that, I will turn it over to Ryan to talk a little bit about why this program is so important. Thanks.
Thank you, Regina. And I just want to say it's really good to be here, this afternoon. Real special thanks and gratitude to all of you for joining us for this informational webinar. And a very special thanks, actually, and I have to call this out to Regina LaBelle, who is the director of this addiction and public policy initiative for addiction at Georgetown, for her outstanding service, notable service to our nation as the most recent acting director of the White House Office of National Drug Control Policy on behalf of everyone who works in this community, addiction, recovery, harm reduction. Thank you, Regina, for that service. So I am Ryan Hampton. I'm an author. I'm an advocate. I'm a person in long-term recovery from addiction myself. And I just wanted to take a few minutes at the top of this call to kind of lay the groundwork for what you're about to hear and why I believe it's so important and I hold it near and dear to my heart. Now more than ever, I believe it is absolutely critical that we begin to build a trained public policy workforce specific to addiction. And let me tell you why. I don't believe it's news to the folks on this call right now that we have hit an unprecedented number of drug overdoses in this country. Just a few short weeks ago, we officially surpassed 100,000 deaths. And I'm going to say that again, over 100,000 deaths within a 12-month period. Sadly, I believe that without systemic policy changes and more advocacy in our own communities, which I know many of you are already involved in, I predict that number is going to continue to climb. It's notable to know that given these current trends and numbers, for every 8 COVID deaths in America, we have approximately 1 drug overdose death, yet federal spending on COVID is nearly 800 times as much as it is for that specific to drug overdose. And this isn't to take away from COVID as a national public health emergency, because it is. It's really only to draw a difference and attention to the massive disparity of what I believe is effective public policy that treats addiction as the other public health emergency that we have in this country. Just last week, a good friend of mine who has been struggling on and off for the last 7 years, he called me and he said, Ryan, I'm ready for help. I need help. I don't know what to do. He's been out on the street using fentanyl and was really afraid that his time was running out, that he could die. And I spent 2 days with him making phone calls to every single place I could think of, hospitals, treatment facilities, public, private, you name it. And the best answer he could get, because my friend had no money, he was on public assistance. The best access he had to healthcare was Medicaid, was that he would need to wait for 8 weeks until he could get a bed in a treatment facility, until he could get treatment for his opioid use disorder. This is unconscionable. You know, when I was looking for help, which was about 7 years ago, I was told that I needed to make a call every single day to try and get help. And the time that I had to wait was 26 days. My friend is now being told he has to wait for up to 8 weeks. So I know that we see the headlines, you know, and we hear the work that's happening on the ground. And for some, you know, it seems like maybe there are some positive strides that are happening. But for those of us who are on the ground really experiencing these real world stories, in certain instances, it is as it is with what I experienced with my friend last week, things are actually getting worse. One of the main reasons I believe that this continues to happen is there is this shortage of trained and effective public policy experts and a public policy workforce that is specifically dedicated to addiction services. I am profoundly grateful that Georgetown University is dedicated to helping to close that gap, hopefully substantially, through this course that they're offering. And I hope that many of you who are on this call today who are able to join in that work if you're able to do so. You know, lots of us cut our teeth in advocacy and activism, direct services, housing, treatment, peer supports, and other life-saving measures. But we also need to tackle public policy from our own hometowns, our own backyards, right up to the White House. And to do that, we need the tools, we need the trainings, we need the degrees, we need the universities that offer the degrees like Georgetown, and we need the resources to do so. So thank you to everybody for showing up for this really important webinar to learn more about the tools and some of the things that we can add to our tool belt. And before I turn this back over to Regina, I just want to take a moment and extend my best wishes to all of you who are joining for a happy and healthy holiday season. I'm very much looking forward to getting back on the road in 2022 and hope to see some of you while I'm out there. So now I will turn this back to Director LaBelle. Thank you all.
Thanks so much, Ryan, for those great words of support and encouragement and for your important work on the ground. Shaima, could I ask you to put the slides up again? Because what I want to talk about now before I turn it over to Dr. Myers is what are the course offerings? So what's this going to look like if you apply and you are accepted? It's a 30 credit program. We wanted to make sure that this was a 1-year program, not a 2-year program or a 3-year program, but 1 year, and you'll learn the science and as well as policy. There are 24 course credits. The courses include healthcare financing, because as Ryan said, you know, healthcare financing is really unique in this space. Addiction policy and treatment is paid for. The majority of it is public pay. So what does that look like? What's the budget processing? Also, you'll learn there's 2 courses in data and statistics of addiction. So what are the data sources out there? What do we know about addiction? And that's taught by Dr. Christopher Jones, who's with the Centers for Disease Control and Prevention and is also a person in long-term recovery. There's a course in just Addiction Policy 101. There's a course in comparative addiction approaches to addiction, where we'll look at how other countries treat addiction, what they do. And then there's a Neuroscience 101 a course in neuroscience and addiction and drugs. And then also there's Addiction Psychiatry 1 and Addiction Psychiatry 2, where students learn prevention, treatment, harm reduction, recovery, the science of those. And that's taught by Dr. Wilson Compton, who's with the National Institute on Drug Abuse. And then throughout, there's 6 electives. One of the electives is an epidemiology class. And then the other elective is can be chosen from a number of courses across the university. And then throughout, there is a program, a seminar that I teach called Integrative, the Integrative Seminar. So the point of that, the purpose of this, it's a 3-credit course where we talk about the science and the policy. Where do they converge? Where do they diverge? What else can we do? We have guest speakers like Ryan come. We have others who are in the addiction policy field who come and talk about their expertise, whatever area of addiction policy they cover. And then there's a capstone project at the end where you can take on a project of your, what you're really passionate about. Where do you think change needs to be made and how would you go about making that change? So again, it's 1 year. We strive to be very practical about what's going to drive change in this field. And that's, I now can turn it over to Dr. Myers where he can talk about some of the admission processes. Shaima, would you mind advancing to the next slide? And the next slide, please. Thanks.
Okay, thank you, Director LaBelle. It's a pleasure to be here. I've really enjoyed being with the program the past semester as we launched the first cohort of students, and it's been going well. I want to tell you some of the specifics about applying for the program and some of the student services and student life at Georgetown University. So the admissions process is given here. It's relatively straightforward. The things that we require are an online application, a resume, a personal statement, 2 letters of recommendation. It could be useful to request 3 because sometimes academics and other professionals are slow in getting those letters in, but we require 2. And for non-English, people from non-English speaking countries or undergraduate institutions, we require a TOEFL or ELTS score. Note that we admit people on a rolling basis starting on April 1st of 2022. If you apply before or by January 15, all application fees are waived, so it'll save you $90. The actual application cycle doesn't end until April, but I would encourage you to get in for that priority deadline. A little bit about financing your education. There's a financial aid office for graduate students. If I could have the next slide. As Director LaBelle mentioned, there's a tuition rate of $45,000. I think it was shown on the last slide. That's applicable to all students. And what we've done is built in what would be a typical merit scholarship amount for a master's student so that everybody receives it. And you get the program at a reduced rate, but still that's a lot of money. And we have a financial aid office that can help you determine financing for the rest of your costs of attendance. The website is here. We have available federal aid and private loans. There's information. Can I have the next slide, please? There's information on financing grad school at this second URL that's being shown on this slide, the top of this slide. An Office of Graduate Fellowships and Awards can give you still additional information on special fellowships and some funding, although these are fairly difficult to come by for a 1-year program. Veterans in particular are very welcome in the program and at Georgetown in general. We have an Office of Veterans Services. The Veterans Office can tell you all about our availability of post 9/11 GI Bill support and the Yellow Ribbon Program, which we are an early member of. The Office of Veterans Affairs can also give you information on advising, networking, and mentoring opportunities for veterans. So as far as graduate student life, there is a website again for graduate student life. There's a career center within the graduate school, a full-time person and soon to be more to aid you in preparing resumes and looking for jobs, etc. I believe that's my last slide. So I have a little bit more to say about this. There are, in addition to these kinds of services, of course, we have a student health facility, an athletic facility. These are provided at no additional costs to graduate students. There's an academic resource center, which handles issues of evaluation of disabilities for accommodations in courses, academic support, etc. There's a childcare facility called Hoya's Kids. Unfortunately, it's often associated with a relatively long waiting list. So if you're a Georgetown employee and you think you want to come to this program, I'd encourage you to get signed up for that now if you anticipate that you're going to need the childcare facility. So there is a rich undergraduate life that includes a number of student organizations that are sponsored by GradGov, which is the student governing body for graduate students. Each program can have a representative in graduate government. And so all in all, I would say that Georgetown is a very robust graduate student life set of resources, but also Washington, D.C. is a great place to go to school. If you're not familiar with the city, it's really the center of the policy world in the United States. It's the place where many associations, nonprofits, medical care organizations are homed, and a very international city at that. So I've enjoyed working at Georgetown for many years, and I think our students enjoy it as well. So with that, I'll turn it back over to Director LaBelle.
Thanks so much. There are a couple of questions, and I think Heather is going to help facilitate them, but there's one that I thought Adam or you could answer, Adam, is financial aid. Is financial aid equally distributed for American and international students, or are there additional opportunities for international students? Are there graduate assistantships available?
Okay, sure. I'm happy to answer that. So unfortunately, loans are only available to U.S. citizens or holders of permanent residency. In other words, a green card. In order to make some financial aid available to everyone, we set that reduced tuition rate, so that same tuition rate holds. Graduate assistantships and fellowships, there may be some. We don't organize them directly, but there are opportunities for such things, and one of those websites that we showed earlier, the fellowships and awards, could give you a lead on those.
So several folks have asked about online or in person. So during COVID, we did have parts of this online. Going forward, however, we anticipate that this will be an in-person program. However, in the coming years, we would like there to be an online program, or have one online program. I would say that's a couple years from now, because there are different approval processes we have to go through in order for that to happen. So for the 2022 year, It will be in person with the exception of the first summer session, which is just a couple weeks. And, we want to give folks an opportunity to get here. So I think, stay in touch with us in the future. We are looking for an opportunity to do this online. Someone asked also about, is it feasible to do this program and work full-time? We have some students who are in the current program who are full-time, working full-time. I think that kind of depends on, all aspects of your life and how feasible that is. Some of the courses are taught in the evening, some are during the day. So Dr. Myers, do you have any thoughts about that?
I'm sorry. What was that last bit?
About whether or not it was feasible to do this, to do the program and work full-time.
Yeah, I mean, for sure, it would be difficult at best. I think it'd be possible to work a good amount, but for example, the few weeks in the summer is that's a period when you're taking 3 courses at once. I can't see that. I think if you have a job where you can kind of juggle your hours a little bit, you can work a fair amount, but probably not full time. So I'll just move on and answer. So the question I was going to answer has disappeared. Maybe somebody answered it on already. Okay, so someone asked, I will be finishing my bachelor's next year. Should I wait for the next cohort? So if that means you're going to be finishing your bachelor's by this coming June, if that's what you mean by next year, you don't need to wait. But if you're talking about June of 23, of course you'd have to wait because we'd be most of the way finished with the program by then. So the question that was asked was, do you take elective programs from other masters, elective credits from others' existing master's program? And the answer to that one is yes. What we've done is entered into an agreement with the public policy program and some other programs that as space is available, you can be admitted into relevant programs with our approval.
I think, is that, I'm not sure that, I think they also are asking about if we would take existing master's degree credits perhaps from another university.
Okay, so the graduate school regulations on that are fairly clear that if you have been awarded credits that counted toward another master's program, they can't be applied to this one. If you have credits of graduate credits that weren't applied to another degree, then it would be up to the directors of this program to decide whether they're relevant. And there would be a limit of 25% of the credits toward this MS at most could be from another program, but it's probably unlikely that we could award that many because we have quite a few credits that we require specifically.
One of the other questions was, do most students work while completing the program? I would say, there are of the students in the program right now, I would say probably a third are, a third are working full-time, and then another third are full-time students, and another third are, kind of working a reduced schedule. I think it depends on the calendar. Adam, can you answer the question about, did I hear correctly that merit-based scholarships are available? If so, could you please speak more about how many scholarships are available and the amount? And I don't know if Heather has answered.
Yeah, so the graduate school in general gives programs funds for awarding partial merit-based scholarships. But what we've done is negotiated to have funds to allocated to simply reduce the cost of tuition for this program from the usual 60-some thousand dollars, believe it or not, for a master's degree down to the 45,000 that Professor LaBelle mentioned. So there aren't any additional merit-based funds available. Everybody gets that $45,000 amount.
Great. One of the questions is, sometimes these types of degrees, a master program, are suggested as an additional degree for people who already have PhDs. Would this be one of those programs, or would already having a PhD disqualify someone? I don't think it would disqualify. The person who's asking this question is eminently qualified for this position, for this.
No, yeah, not at all. I mean, having a higher degree is not a problem if you have a PhD in sciences or clinical care or public health, whatever, and want to enter into drug policy or related things. I think it's a great direction to go in.
I don't know the answer to this question. If one gets selected, will there be accommodations available for international students on campus, or they have to search by themselves? And is there spousal accommodations?
Right. So graduate student housing has been discussed continuously at Georgetown, and I think the best thing to do is check with us. At the very least, I think Georgetown can point you in some right directions about what areas of town you might want to live in and how to look for housing. I'd be certainly happy to help in that regard too, but I don't think there's any graduate housing online right now. If you want to email me later, I'd be happy to check into it and answer you though.
We have a, it's addiction policy at georgetown.edu, which I believe is on the first slide, but addiction policy at georgetown.edu. If there are questions that we were unable to answer today that are really specific to your, to you, we're happy to do that, to answer those questions. I think, majority of a lot of the questions were about this being virtual. I mean, obviously, we understand that there are many people who are interested in this field and who are already in their careers. We want to make every effort to make this virtual. It's just, there's a few bumps in the road or a few things we have to do before that can become a reality. So folks should stay in touch with us.
Regina, we might want to answer this question about the last one there about resources networking for students for career opportunities. That's something everybody wants to know when they come to a program.
So, what I try to do in the integrative seminar is to make sure that we bring folks in who are leaders in the addiction field. And also, for example, in January, and this isn't part of the class, but I'm going to host a careers and addiction policy, Zoom seminar for the folks in the program. I think the capstone is a really good way for folks to get experience on a particular issue. My interest in this program and why we started it is to make sure that when people come out of this program, they hit the ground running and they're making a difference on an issue they really care about. So the networking possibilities are, we want to make sure that happens. The other thing that we do as part of our integrative seminar is to allow folks to get, to who, when we are asking the class, members of the class to introduce whoever's speaking and to connect with them beforehand, to ask them a little bit about themselves, more about themselves so they can make a good introduction. That's also a really good opportunity for networking. So, you know, and the people who are the professors in this program are, you know, very prominent in their field as well. So there's that opportunity to get to know them and call on them for career advice. So yes, that's a big part of this program.
So Nikki Carter asks, in addition to drug policy, are any other courses focused on drug policy? And Regina, you might have something to say about that, but a couple of the courses that are offered as electives deal directly with drug policy. Is there anything else, Regina?
Yeah, I mean, the integrative seminar, we focus a lot on drug policy. What we're trying to do is make sure that there is, you know, that there is attention given to other types of addiction, as identified in the DSM-5. But you know, so there's quite a bit of emphasis on drug policy throughout the work that we do.
Okay, great. And Timothy Cheney asks, is credit available for life experiences working in the field? Unfortunately not, simply because when you're doing a one-year master's program, that's a limited time for teaching a group of students a body of information that they can go forward with and become professionals. So we can't really offer that life experience credit.
But especially in the integrative seminar, your life experience really, you know, really helps. I mean, the people who are in the program now have a lot of life experience that they bring to the discussions.
So Candace Smith asks a great question. Are there opportunities to practice harm reduction on campus or in the area? And I'll tell you this, that there are things already going on in those areas. Our group of 9 students this year, as far as I know, haven't been formally involved, but I've encouraged them, and I'll encourage anybody who comes in next year, that Georgetown doesn't have on campus, as far as I know, for example, a 12-step program series. That's an obvious place that students could start in that area, and there are other organizations as well that you could get involved in within the city.
So there's a couple things in addition. So Hoya Dope is a project that is at the medical school, and they're medical students who distribute naloxone and do other programs in the area. We also, because the other half of my job is directing an initiative at the Law Center, we have a lot of ties with harm reduction groups in Washington, DC. So again, as part of that networking, you know, we have students in the program right now who work in harm reduction. We devote parts of our integrative seminar to harm reduction. There's a big emphasis in the work that we do.
So Elba Guzman says, asks if this master's degree could enrich preparation of students for diverse subjects such as nursing or psychology. And I would say yes to that. We have a psychiatry trained individual from NIDA who teaches 2 of the courses. We have people who are looking at neuroscience, specifically of addiction, in a couple of the courses. So lots of good information that one could take back to a career in nursing or psychology about addiction and its treatment.
Yeah, I mean, we would love it if addiction were integrated into every field of study, particularly nursing, psychology. It is in psychology probably more than nursing, but I think there's great, as Dr. Meyer said, there's great opportunities here.
Mike Doyle asked, what if a major variant of COVID pops up during the program? Do we need to wait until any possible lockdown measures end to resume classes? Well, I can tell you that Georgetown was very quick in adopting virtual measures last year in March when the first big wave of COVID came through, and we didn't miss a beat. So I would think that we could go into a partial or complete lockdown either for a short or a long period if we need to. Tanya Harris asks, it says that it seems to be very limited in the diversity opportunities due to the many restraints. I'm not exactly sure why you think that we're limited there, but I can tell you that Georgetown is always talking about diversity and social justice. It's one of the key tenets of the Jesuits. Georgetown is a Jesuit Catholic university. There are lots of opportunities for participating in seminars, in workshops, et cetera, in that area, and something that we're always concerned with.
I mean, we also, the other, piece, so again, we have an initiative at the Law Center where we're actually recruiting people for a fellowship program, addiction policy fellowship program, which is not, it's not a year-long master's program, but that's another opportunity to get involved in on this issue and get training in the issue with people with lived experience. So if that's of interest, we can connect you with the folks who run that program as well. Anything that we've missed?
So, Timothy, I congratulate you on all the good work that you've been doing and progress that you've made in your own career. And Marshall, you mentioned your experience in psychology and community studies. Really this program has a lot of, well, among the 9 people, it has several people with lots of work experience, lived experience in the area of substance disorders. So it's designed for people who have experience and can go forward with that to learn more and understand what the current thinking is, where the policies are going. If you don't have any experience, it's going to be a little bit of a learning curve, but we can accommodate it. So we welcome people from all spectrums of experience level. Is it important to have lived experience to excel in this program? So that's the other side of the coin. It helps. I wouldn't say it's absolutely necessary. And I think that there are very few among us who hasn't in some way been affected by issues of substance disorders. So I think, all of us, there's a common thread, and that common thread can carry you through even if you don't have that direct lived experience. How many applicants are accepted into the program? We anticipate maybe around 15 students for the coming year. It's never going to be a big program. It's a very hands-on, heavily mentored program. So we think maybe it could go up to 20, possibly a little bit above that in the intermediate future. But for now, let's say 15. And we're taking that out of a pool of applicants that's quite a bit bigger. But if you meet the basic requirements of a 3.0 GPA from an accredited university, have a strong interest in this, and can state your case, we'll take a good hard look at you, and you do have significant opportunities to be accepted. And for now, applications are free, so we'd encourage you to get that in by January 15th. So I see Shelley Wiseman is on answering some of the questions, and she's been with us too. Shelley, did you have anything you wanted to say?
I don't think she can because she's not on the
Okay.
panel at all.
Okay,
Shelley
great.
Weissman is overseeing the fellows program. So she has put in the chat the application for it, and the focus for the application for the fellows program is people with lived experience with addiction, and there's no minimum degree requirement. As I said, it's Addiction Policy Scholars Program. And she at 4:40 answered that. So if you want more information on that program, there's a link to it in the chat.
So Randy Beard, thank you for your kind offer to contribute to the program. Feel free to send us your email and tell us, send us your CV, and, there may be some point at which you could help us out.
Someone also asked about, is it for a class schedule? So again, we can send, if you email us at addictionpolicy@georgetown.edu, we can send you what we anticipate it'll look like for next year. And also, answer any specific other questions that you may have.
So thank you all for coming. It's been a pleasure presenting this today. Regina, thank you for moderating this and carrying this program forward.
Thanks, everybody. Thanks, Dr. Myers, Heather, Ryan. We really appreciate everyone, working on this. It's a real labor of love for a lot of people at Georgetown. And, we have many opportunities ahead of us to have a virtual option, to have dual degree programs. There is one other program that's similar to this in the country, but it's very unique. And there are many opportunities before us, and we look forward to all of you being part of this. And again, addictionpolicy@georgetown.edu, and we can get you additional information or answer any questions that we weren't able to get to today, or that you might think of in a week or so. All right, with that, we'll leave you. Thanks so much.
And thank you, Ryan.